Hello friends, today we are going to start a new scenario in our institute and I want that all other students of BMS will be benefited from this. So we are going to also launch our YouTube channel for General Club, that is Ayur General Club, and with the tagline of Chintan Manan and Vimarsi. So in this particular lecture, we will talk about the introduction and importance of general article reading for BMS students. So myself, Dr. Gaurav Soni, Assistant Professor in National Surrey in Northeastern Institute of Ayurveda and Homeopathy. So I will be mentoring this particular club with the help of my students and the colleagues. So today's topic of discussion is the elevation of Ayurvedic learning, that is introduction of general class for BMS student. The aim of this system will be, or the program will be, to equip the future BMS practitioner with critical thinking skills and learning how to get the evidence-based practice. So why the general clubs are so important? What is the imperative for modern Ayurvedic practitioners? So first of all, when you read a journal article from a good journal, then you are going to be still current. Like we know that medical research evolves rapidly and over 2.5 million biomedical articles are published annually. So you can see the gross number 2.5 millions. But we don't need to read all of them. Whatever is required to us, we have to read that much only. Next, you can see it will be evidence-based Ayurveda, like it going to bridge the traditional knowledge with scientific validations, and it also going to ensures the credible integration. So globally, we can be given the validatory type of medicine practice. So we are going to get a global recognition. This will be achieved by worldwide acceptance of our pathy. And then, of course, we are going to get the clinical efficacy. So when we are going to learn about more new decisions, new type of papers, new type of therapeutic choices, then we can choose a more precise one about the therapy which we are going to use for our patients. So what are the core objectives of this particular program? So you can see here it will be the critical apprehension. Means we have to think about some critical sizes, critical values. Like when we are going to read some RCTs, like a randomized controlled trial, then we are going to evaluate what is the methodology, what is the significant value, how is the sample size calculated. You don't need to worry about any of these new words. We are discussing in simultaneous lectures one by one along with the topic which the students are going to be representing. Then we are going to learn, our students can learn the scientific communication, how you can improve the scientific communication. I study shows that by reading particular type of journals, you can 30% of communication skills or presentation skills can be improved. Then it will be collaborative type of learning. Means we will talk about engage different specialists, experts, and we are going to have a peer-to-peer discussion also. Then it's a type of knowledge translation, means applying the research insight directly into the clinical scenarios. So it will enhance our practical application. So how we are going to engage in our this particular type of learning process? So when we are going to start our general reading process, so you can see we can go for the article selection. Then articles should be relevant to particular group of students. For example, if it's a final year or second year students, so we can go for some clinical trials on Ashgandha. Like there should be a pre-reading process. Pre-reading means you are going to upload that paper in the group which you have found for general club, and all our students have to read certain part of particular topic which will be discussed in the physical session. Then there will be certain preparation for presentation like summarizing the key points, methods, implications, and the target should not be more than 15 minutes. So it should be a learning process, but bit of fun type of activity. Then what we have to do, we have to present and summarize whatever is the core in the article we are going to find them. Then we are going to facilitate the discussion here. My name is written because we are going to facilitate the question answer sessions and try to give the answer to the inquiries of our students. Then there will be a critical debate. So group discussion will be about the strength, weakness, and clinical relevance of that particular topic. And then we will summarize as a takeaway messages. So we are going to identify the future prospects about that particular paper. So why we are going to do this? So we are basically going to do because we want to develop a research aptitude, which is the will be the gateway to Ayurvedic innovations. How? First of all, we should know how to frame the questions. So question formulation should be there, which is a technical term is here written PQ format. We'll discuss afterwards. Then methodological understanding how different type of research designs are working. What is RCT? What is cohort study? What is case study? How to interpret the data? जो भी डेटा आपको मिला उसको समझिए कैसे, how to understand the statistical significance and how this significance can be used in clinical relevance matter. Then we have to also understand the ethical consideration, whether the research has been done ethically, or the points are there, whether IC was conducted, whether CTRI is there. And then we have to identify certain gaps which we can use in future for our own research projects. So in a zeal, what will be the importance of general reading in BMS can be summarized like this. It will be act like a bridge between traditional and modern sciences. It helps in development of research aptitude. It improves the case presentation skills. Remember, skills can't be learned by theory. It have to be performed. You have to learn. You have to get trained. Supports the ethical and responsible practice. It will be the foundation for evidence-based practice, which is the need of time. It will be helping you to keep yourself advanced with all the modern type of researchers which are going in the Ayurveda prospect especially. Also, it is going to help you in competitive exams and PG preparation, giving the forms of the basis of questions and improve the comprehension about the learning process. Then it will ultimately give you the fostering the critical thinking. Now remember, critical thinking is very important when we are going to make the differential diagnosis for any disease. So how it is going to help? You can see some examples are given also. So like helps relate the classical Ayurveda principle with modern scientific findings, like research of turmeric haritra confirming its anti-inflammatory action correlating Sodhara property described well. So we already know turmeric is going to is Sodhara, but we have to prove it how or how it is going to act, like what will be the dose of that particular or in this particular disease we can use this particular turmeric. Okay, so these all things are already being done. Many things are done. We have to just take out the correct paper and we have to analyze that paper properly. Likewise, we can go for clinical trials comparing Panchkarma with modern detox protocol. So we can see the protocol papers, we can see the SOP papers, we can see some case papers, and accordingly we can improve ourselves. So when you go through this process, you can see we are going towards this pyramid type of learning process. So first of all, you can come to the base side. So if you read proper papers, you can discuss properly, you are mentored properly. Then what you are going to gain? Enhanced clinical reasoning. You can see it is 20 to 25% of diagnostic accuracy can be improved, enhanced by going through the general articles itself. Then we can have some improved treatment protocols which can be more effective for patient management. Then we will gain the professional confidence. Graduates will be better prepared for competitive healthcare environment, future exams, jobs. Then after all this phenomena, whatever we are going to do, whatever practice we are going to do, it will be a lifelong learning process. And remember, we all have to be a learner. Learning should be the part of our life. So whenever you learn something new, somewhere, somehow it is going to be benefited to you. So the benefits will be, if we talk about direct benefits, it will be global competence, position of Ayurvedic medicines on global scientific platform will be enhanced. Innovation drivers, we can get some research questions which can identify certain gaps और उस गैप के ऊपर जब काम करेंगे then we can go for some innovations also. We can develop some machines, some tools, some software which are going to help in the patients as well as the practitioners for the traditional medicine. Then it advocates the healthcare, become the informed voices of integrated healthcare, and ultimately it will help you with the career advancement because strong research aptitude opens the door to academic and research role in various positions. So when you want to start your general club, so you can go through one of my paper that is in role of general clubs in undergraduate for BMS students, which is published in GIM. So what in the core we can see this diagram. You can see first of all there should be faculty mentorship. Each club should be assigned a faculty advisor. Then there should be a regular meeting It's not necessary that every day or every week we have. It can be once in a month or twice in a month also. Like we are having every second Saturday. Then there should be resource access. Your college, your library should have resource access to certain journal, uh, like PubMed journals, ISSS portals, Scopus. Then we can form a small group of students or large group of students as per their active participation, and we can have some interest up. So those who want to come to this, it can be a voluntary type of club, and we can include this thing in the non-lecture hours of our curriculum also. So at the end, we can summarize this that it is going to empower your Ayurvedic journalists with the knowledge. It will be the cornerstone of your growth. It develop your skills, developing critical skill, communication skill, research skill. That is all our soft powers, and ultimately the scientific advancement. So you are going to give some contribution to the scientific advancement of the Ayurveda also. So as it can be said, the future of Ayurveda depends on its integration with rigorous scientific inquiry. So this will be the point on basis of which we are going to start this particular system of our new learning process. And I hope that all other will also get some advancement from what we are doing, and they will start this process in their own college also. So these are some photographs when we have conducted this first session, and it was also encouraged by our faculty members and our directors also. So that's all for today. We will continue this process. I will be uploading the videos of the lectures also, which will be conducted by our students, and some knowledge purpose lectures from my side also. Thank you. Thank you very much.